welcome back to the Osteo and Physio YouTube channel. Today we are going to be looking at our top exercises for knee OA. This causes a lot of guarding, stiffness and swelling around the knee, in particular joint tenderness on the medial side, on the inner side, typically causing compaction and joint deformity. What we normally find with people is when we get really bad knee OA, we tend to want to hold it still, but actually the best thing to do is to get that movement through the knee, and that's what we want to develop over time. So for the main vectors of knee movement, we're looking at knee straightening and bending, so flexion and extension. The reason why is what the movement does is it helps to lubricate joint surfaces, so it reduces that overall stiffness over time and helps to regain vectors of motion. We want to aim to do it slow and controlled within a pain-free range, in flexion and extension, and then going into internal and external rotation. So this involves turning the foot inwards and outwards with a bent knee at 90 degrees. All vectors of movement slow and controlled, aiming for 5 to 10 reps in each vector. We then want to move on to knee strengthening, initially looking at body weight strengthening, so we're not adding any resistance. Again, we want to activate through the main muscle groups, which are the quadriceps and the hamstrings. So what we're going to start off with is bringing the leg out straight as far as you feel comfortable, so you don't have to force it to end range at all. It's meant to be adding it up over time, holding for 5 seconds, gently and slowly back to midline, and then bringing heel towards the bum to activate through the hamstrings. You want to aim to hold between 3 to 5 seconds and approximately 10 reps or up to 10 reps in each direction. Once you feel comfortable doing this, you then want to add resistance to the strengthening to build this up over time. So all of this should be slow, controlled and within a pain-free range, and with knee OA you're adding all exercises up gradually and progressively. So you can tie a TheraBand around a chair, and what you're going to do is same as before, is you're bringing the leg out straight, holding at end range for 3 to 5 seconds and gently bringing it back to neutral. This is starting to build the quadriceps muscles, which gives support around the front part of the knee, so the anterior aspect. And we want to add this up over time, so bringing it in gently and slowly. We then want to look at hamstring activation. So as you can see here, I've placed the TheraBand over and underneath both toes and both feet. What we're then looking at is bringing the heel towards the bum. So we're trying to flex the knee, so adding that resistance. So it's quite hard to do this seated, so I'm doing it standing, and you can't see in the video, but I'm actually holding a chair for support. You want to hold at end range if you can for 3 to 5 seconds and going gently and slowly through this range of motion. Another key element to helping with knee OA is also stretching and releasing around the knee. So not only do we want to strengthen, but we also want to stretch. So the first option is bringing heel towards the bum and holding between 10 to 15 seconds. What we're finding here is a lot of people with knee OA struggle to get the heel up towards the bum, so you can use a towel to help with that quadricep stretch, holding between 10 to 20 seconds, slow and controlled. Same with the hamstring stretch, perching it up on a slightly higher surface, pillow on underneath the foot and leaning the body forward, putting weight through the bent leg. So you're stretching the straight leg, hold for 10 to 20 seconds.